Millions of Americans have varicose veins. However, women are 4 times more likely than men to develop the disease. The twisting, bulging, rope-like veins on the legs and ankles have the potential for developing into serious medical issues. Varicose veins develop when the valve in a vein becomes weak or damaged and doesn't close properly. An impaired valve can cause blood to flow backwards and pool in the leg. Symptoms can include pain, aching or throbbing of the legs, heaviness or leg fatigue, swelling of feet or ankles, restless leg syndrome, night cramps, itchy veins, varicose veins, non-healing ulcers. Up to 50% of American women may be affected by varicose veins at some point in their lives. Dr. Charlie Hahn of Veins, Florida explains why the condition strikes more women than men.
Varicose veins most common happen to women because they have hormonal changes in their body, and then when they get pregnant, it tends to develop after pregnancy. And if they have a job required they standing on their feet for a long period of time, tend to develop varicose veins also. The reason being is our body works against gravity. And so when you're standing up for a long time, the gravity will pull the blood down, and the body trying to prevent that by using a valve system in the veins. Over the years, the valves can worn out in the veins that cause varicose veins. And then they cause a tremendous amount of pain once the blood in them become clots. And we call the thrombophlebitis. And also, the larger it gets, they tend to pull more blood, which causes skin changes, color changes around these large varicose veins. It can cause skin ulcers, which will take a very long time to heal. And also they can cause a large amount of bleeding if they got injured. Usually you tend to notice the leg feel heavy, and there's a lot of swelling. Treatment can relieve a lot of stress for them. The procedure is very minimally invasive. We have our own surgery center. Patient come here, they will have some sedation, which they will not remember or feel any pain during the procedure. And then we have the ultrasound machine, which we localize the vein and access the vein with the ultrasound help. And then the device is very thin. It's like a hair. It will place into the vein, and the laser will work. It usually takes about 5 minutes. And then I will remove the device and perform either injection or clean up the varicose veins with microflebectomy. And usually it's about 20-30 minutes. And then the patient will have a dressing, wake up from surgery, and they've been watched for about an hour or so, and then they can go home after that.
If you'd like contact information for Veins, Florida, just click on the Get a Leg Up story link icon on our homepage at yourhometownhealth.com.